Heart attack symptoms. We will decode heart attack symptoms today. What are the symptoms of heart attack? You should know. And why is that? Because if you know that these are the heart attack symptoms, you can take the medical advice and the medical service at the earliest phase. And if you take the medical service at the earliest phase, your heart muscle can be saved. Your life can be saved. After treatment, the disability or the complications of the disease will be less, if not none. That's why the awareness of heart attack symptom is very important. What is the commonest symptom of heart attack? The commonest symptom of heart attack is chest pain. 80 to 90% cases of heart attack presents with chest pain. And why this chest pain happens? This chest pain happens, the heart is nothing but a muscle. A muscle, a sac of muscle. So it's a sac. When the blood comes, it holds the blood, and then the muscle contract, it pumps it out, and the body gets the oxygenated blood with nutrition and all. I will show you in a moment. Hold on. So this is basically the heart, right? You can see this is the heart muscle. This muscle, this dilates and contracts. Dilates to receive the blood, and then contract to send the blood to your body. Now you can see these red things, red lines. These are arteries of the heart, and the blues are veins. So heart is a living muscle. It dilates and contracts to send blood to your body, and to do that, to perform that, it also needs oxygen and nutrition that is getting supplied by these arteries, right? So what happens in heart attack? In most of the heart attack, not all. I have a separate video on the causes of heart attack, so I'm not going into detail into that. But most of the heart attack happens when your artery gets blocked, gets choked by the cholesterol plaque, right? So cholesterol plaque or atherosclerotic plaque are a combination of fat body cells that gets deposited in the heart arteries, and the arteries are very narrow. As the atherosclerotic plaque gets deposited inside the artery is getting choked gradually. So in the initial stage, suppose with 50, 60, 70%, 80%, even with 90% block, you can walk and have some chest pain. But at that point of time, you are not having heart attack. This is, my dear, known as angina. You walk or take stairs, you have some chest pain, chest heaviness, some squeezing sense inside your chest. But if you take a rest, within 10 to 15 minutes, your chest pain goes away. This is angina. Heart attack happens when 100% of this, 100% of the artery gets blocked. Suppose it gets blocked in this position. Then this area of the heart, right, that is getting supplied by this artery will not get oxygen and nutrition. And if it doesn't get, it will start dying. And when something dies, that shouts, I am dying. And that you get as a chest pain, the shouting, the the gradual dying heart muscle shouts, and you have the chest pain, the squeezing chest pain, which can radiate. Now, the chest pain, the squeezing chest pain, the heaviness in the chest due to heart attack can radiate. And why does it radiate? It's a complex anatomical phenomena, but let us put it in a very simple way. It radiates, means you can feel the heart attack pain in your jaw, in your left arm, in your right arm, in your stomach, anything and anywhere between your jaw and the navel level. You can feel the pain of the heart attack because the neurons that supply these areas, means jaw, your arm, chest, upper part of the abdomen, it belongs to the same origin. When we were in our mother wombs, we were unicellular. From that, multicellular organs, the whole human body came. So they have common sources of nerve supply. That's how the heart attack pain, the squeezing pain that almost always persists more than 30 minutes or so, radiates to your arm or your neck, your jaw, your chest, upper part of the abdomen up to the navel level. If this happens, do not ignore it. Do not ignore it. I had a patient who was having angina, and he was on some heart medications, but he was not that compliant. He's sometimes taking medicine, not taking medicines. He never listened to me. He keeps on smoking. He was a moderate alcoholic. One day, he felt upper abdominal pain, right? And that pain also was radiating to the left of the arm. But he ignored it. He thought, okay, I think this is a gas pain. This is the pain due to acidity or acid reflux. You understand? And what happened then? He ignored. He took antacids, he took tablets. He was taking rest, thinking that this will subside. But it was never completely subsiding. Even after 30 minutes, it was persisting. He was sweating, he was having palpitation, but he stayed at home. And when he reached to the hospital, majority of the muscle which was not getting oxygen was dead, because he reached to the hospital after 10 to 12 hours. So when you reach to the hospital after, say, 12 hours or so, you completely lose the chance to revive your muscle. He got the treatment, angiogram was done, he was found to have one blocked artery, angioplasty was done, but his heart function, means the capacity of the heart to pump, never returned back to normal. It was 60%, 70% when he was having angina, but not the heart attack. But as it delayed when he had the heart attack, his ejection fraction dropped to 40%. And it never recovered. And you know why? The reason it never recovered, because he delayed. Have a chest pain? Okay, fine. I completely get your point. Not every chest pain you should rush into the hospital and so. You took the antacid. Fine. Half an hour. Stop loss. Stop there and go to hospital. The complications, medical expenses, everything is higher with every hour of delay. Every hour of delay, the mortality, the death rate due to heart attack rise. Do not delay. And even if that chest pain or that so-called gas pain, acidity pain gets relieved by whatever medication you have taken, have a checkup. Go to a physician. Have a checkup. Because it may be an anginal pain. Your arteries may be 60-70% blocked and it gets relieved by some acidity or antacid medicine. You think you took the acidity antacid medication and the chest pain got relieved. You thought that this was a gas pain, but this was actually, it may be a simple coincidence. What is the harm of having a checkup that would not cost you more than 5,000 in a year? What is the harm of rushing to the hospital after half an hour? When you can change the disease outcome, right? You can change it. Your medical expenses will be reduced drastically. The complications will be reducing drastically if you reach the hospital and seek doctor's help at the earliest of phase. Fine. So I think I have made my point clear, and the chest pain point is gone. The next point is palpitation. You have irregular heartbeat, sometimes lower heart rate, sometimes high heart rate. And due to this irregular heartbeat and all, you feel the palpitation. And why palpitation happens? The palpitation can happen because of the simple facts that those nerves that is inside your heart muscle is now hyperstimulated. They are also dying. They are also shouting. Shouting means they are generating electrical impulse irregularly. If the natural pulse generator, the natural pacemaker that the nature has put inside your heart, which is called SA node and AV node, if they get damaged in the process, then you may have bradycardia. You may have even the heart can stop suddenly, cardiac arrest. And if the damaged heart muscle sends electrical impulses irregularly, you may have a heart rhythm which is known as ventricular tachycardia, can even kill you. That's why you feel palpitation beside chest pain. You may have both the sides. You may have very high heart rate or very low heart rate, depending on which part of your heart is getting damaged. If the lower part of your heart gets damaged, then you may have low heart rate. If the frontal part of the heart and other part of the heart is damaged, you have tachycardia due to heightened sympathetic activity. Let's move on to the next symptom. The next symptom is shortness of breath. I told you earlier that heart is a pumping sac, so it pumps the blood. So when a part of the muscle gets damaged, the pumping power of it reduces. And as the pumping power reduces, it cannot pump out the around 5 to 6 liters of blood that it should pump out per minute. At that point of time, your lung gets filled with water. If the heart is unable to pump, the blood that is coming from the body to the heart and going to the lung. So heart, when damaged, can receive the blood slowly, but when it is going to pump it, it will not be able to pump the 5 to 6 liters of blood that it normally does. So the blood will be backlogged to your lung, and it will fill your lung with fluids, and you will feel shortness of breath. You will feel that you are not having the air as much as you should have. That's another symptom of heart attack. The other symptom is very simple, that is sweating. So when you have heightened sympathetic activity, you are very highly stimulated, stressful, you sweat. You can have profuse sweating. And then another thing that can happen, fainting. And if the heart muscle fails to pump the blood due to the damage to the heart muscle or irregular electrical activity, then your brain doesn't get the oxygen and blood supply that it should, and people faint, right? That also can give rise to vomiting. And why vomiting can happen? The vomiting happens because the lower part of your heart is very richly innervated, means it gets nerve connections from a nerve known as vagus, and the same vagus is a parasympathetic nerve supply your stomach also. That gets hyperstimulated when damaged, and it leads to vomiting. The patient has bradycardia and vomiting. This is the commonest cause of why the heart attack patients may be having vomiting. Now, the heart attack symptoms in women is a little different. I have a separate video for that, heart attack symptoms in women. So I'm not going to discuss it here. But one question I will hear people or my patients ask often: can heart attack happen silently? The answer is yes, of course. 20 to up to 60% heart attacks can happen silently. Means you have some palpitation, some sweating, you did not have that extreme chest pain, and later you found out that you had a heart attack. And mainly these heart attack happens when you are diabetic, you got some surgery inside your chest, you have neuropathy, means somehow your nerves of your body and the nerves that supply the heart muscles are involved. Leprosy patients, which is very rare today, they also don't feel the pain. So these group of people whose nerve that supplies the heart gets damaged in some way or the other, their heart attack can happen silently. Silent heart attacks are common in patients group who are extremely old and human population. Now the next question will come, that why heart attack happens. I am going to put a separate health video for that. But now I think made my point clear on heart attack symptoms. So these are all heart attack symptoms. The commonest symptom is chest pain. I have described how chest pain happens. Other symptoms are shortness of breath, sweating, palpitation, vomiting, and loss of consciousness. And I will repeat again, please do not treat yourself with antacids and home remedies for more than 30 minutes. And even if the symptom gets relieved within 30 minutes, please go ahead and consult a physician for the checkup, because See the opportunity cost. If you have a heart problem and you get checked up and you found that actually it was not a heart attack, it doesn't matter. You have lost 5,000 rupees. That's all you can lose. But what if you had a heart attack? How much you can lose? Your life. So in one hand, if you get yourself checked up, rush into the hospital after 30 minutes, 5 to 10,000, 20,000 cost max. Here, life is lost. It doesn't worth it. Do not hide from the fact that you can have heart attack. Hiding is not going to solve the problem. Fearing and being anxious that if I become a heart patient and all, it doesn't work. If you have the disease, you know that you have it. You have to do two things. Number one, do the treatment, and number two, make sure it doesn't happen again. You have to take steps. Your anxiety, fear of being diagnosed as a heart patient or not reaching the hospital after 30 minutes or not seeking physician's consult whether you are having a heart disease or not is not useful. These are not serving you well. The delay, the fear and anxiety can cost you your life. It can only increase the disease complications, nothing else. So don't have the anxiety and fear that you will be diagnosed as heart patients. You are not getting diagnosed as heart patients by some doctor. You are already a heart patient and you are getting diagnosed so that you can get the treatment and you can go for the prevention also. And don't delay. Don't give home remedies time for more than 30 minutes. It doesn't worth it. I think I made my points clear. And if this video can save lives, my purpose of doing this whole discussion with you, awareness, know, have the knowledge, and then act accordingly. It can save millions of lives and billions of dollars in disabilities. I wish you all best of luck. Thank you for listening.